Now here's a quiz question for you. Which is the more likely cause of death in women? Breast cancer or heart disease? Well, a lot of people would answer breast cancer, but in fact, it's heart disease by a country mile, 5 times more common in fact. And the evidence is that doctors often miss heart disease in women, and when they do recognise it, it's often undertreated, which can result in life-threatening delays. Well, a major hospital in Singapore has recognised the issue and put their money where their mouth is. They've opened a special heart clinic just for women.
Suddenly I felt there's a jaw. I felt there's some uncomfortable feeling at my jaw, like locked jaw. Then I told myself, what is this all about? And I could find there's some sensation go down to my arms. And that's it, and I have a lot of wind pushing behind my back. So I thought it was some wind or some food that I had taken after my breakfast that causing this uncomfortableness. I went to lie down, but the whole night there was no relief for these symptoms. In fact, it never occurred to me that it would be a heart-related problem.
I was really struck that many women, like Rosia, would come in and they would start off their session with me by apologizing for taking up my time for what must be a man's disease. So they would come in and tell me, I'm so sorry to bother you. I'm sure it's not my heart, but I've got chest pains.
Yeah, it was so terrible. And I'm a nurse myself, not knowing that danger is coming my way. Yeah, so around 4 a.m., I told my husband, come, I think we should go to the hospital. He said, never mind, wait till morning. I said, okay, so I lie down. I managed to get about 2 hours sleep uninterrupted.
So there are big differences in heart disease between men and women. Let's take, for example, the most common heart attack. First of all, in presentation, men tend to present with symptoms, the classic Hollywood symptoms. They get this huge heart, central chest pain, they're hunched over, they're sweating, and so on. Women tend to get very atypical symptoms of a heart attack. So they are more likely than men to present with jaw achiness, for example, pains in the back or in the neck, literally a pain in the neck. And then there are differences in the way men and women respond, even if the symptom is the same. It is well known that women tend to have microvascular disease and more endothelial dysfunction. What does that mean? When a woman comes in with a heart attack, we are less surprised if, when we do a coronary angiogram, there isn't the blockages of the main heart arteries that we see in men. And that's because in women, it's the smaller arteries that are affected and the microvascular function that is abnormal. So right down to the basics, there are actually differences between men and women. So just as there are differences in the disease, treatment can be different. For example, if there are no blockages of the big arteries, then there's nothing to clear by angioplasty or to put stents in, and what we need to focus on is medical therapy and, in a more holistic way, lifestyle measures. I cannot emphasize more how important those are in preventing and in treating heart disease in women, which means keeping a healthy diet, which means making sure that by medications, lipids are well controlled and blood pressure is well controlled, which means also exercise and, even in a broader sense, dealing with stress. I just became really, really passionate about starting this program. And what I feel is that it is a one-stop, integrated source of cardiovascular care for women, by women, attacking our number one killer together.
Hi, good afternoon, Rosia. I'm Shet May, your dietitian. I provide dietary counseling to our patients to help them to reduce their risk of cardiovascular risk factors, for example, control of blood cholesterol, their body weight, as well as blood pressure.
Now, currently, are you doing any exercise at all at home?
Sometimes when I'm not busy.
Okay, so how frequent is it?
Maybe 1 week, one time.
1 week, one time.
Twice, depending.
Depending. Then maybe I can suggest that you can do something simple at home, okay? Maybe even while watching TV.
I just thought we would do some breathing and relaxation training exercises with you today. Slow breath in. Maybe we can find pockets in your lifestyle that you can put this in to let your stress level just dip for a while through the day.
The heart-mind relationship is well known to be very strong in women. The epitome of this is in a syndrome we call the broken heart syndrome. The medical term would be Takotsubo cardiomyopathy or apical ballooning syndrome. We know that this typically occurs in an older woman after receiving a very bad piece of news, like the death of a loved one. They have what is on all other purposes seems like a full-blown heart attack. They are as sick as any other man who comes in with a heart attack. They can collapse and die from it. But when we do an angiogram, there is no blockages of the heart arteries, and yet in all other respects, they act like a heart attack. To me, this is a very extreme example of how stress can play a role in affecting the heart, and how important it is to learn stress management and healthy lifestyle management.
In the first place, I should have gone to the hospital direct or call the ambulance. Right? That means I don't care about myself. You know, normally nurses, they don't put themselves first. If my husband tell me he got that chest pain, I know that it's a heart attack. But to me, I can't believe, because I don't believe that I will have a heart attack, or I don't believe that it's a heart attack because I got no ailments, no symptoms, only on that very day. Is it fair?
Now, as I said earlier, it's really important to appreciate that heart attack symptoms in women are not the same as men. Chest pain as a symptom is not as common in women. They are more likely to experience things like dizziness, unexplained anxiety, coming out in a cold sweat, unexplained fatigue, a feeling of tightness in the chest. If a woman experiences this set of symptoms and they last for longer than 10 minutes, don't wait till you've got the dinner in the oven. Don't wait till the family's all organised. Dial the emergency number for the ambulance. Nobody's going to complain about a false alarm.